Question number 1, Willie Rennie.
To ask the Scottish Government what impact reductions to the Fife Health and Social Care Partnership budget will have on its ability to meet rising demand for social care.
Jean Freeman.
The Fife Integration Joint Board budget has not decreased but has increased by £14.7 million this year, taking their budget to a total of £511.7 million. The IJB board has reduced its budgetary pressures by nearly £9 million since it was established in 2016-17. The deficit, which continues to need to be addressed, it needs to be addressed by NHS Fife and Fife Council and the IJB, and together with COSLA, we are engaging with them to systematically reduce that deficit in a planned way without reducing capacity.
Willie Rennie.
But the demand for social care is rising, and there's a £15 million gap in the budget of the partnership. As a result, the Lang Centre and the St David's Centre in my constituency are to close, charges have increased, and complex and respite care packages are to be cut. So what is the Cabinet Secretary going to do to make this stop?
Jean Freeman.
Well, first of all, I'm going to use accurate figures. There isn't a £15 million gap. There is, at the moment, in the 1920 budget, an £8.5 million gap, which, as I said in the answer to my first question, has come down by some £15 million, from £15 million, which is a deficit budget that the IJB was started off with and was a deficit budget agreed by NHS Fife and Fife Council. And actually what happens is that every year since then, both the Council and the Health Board have contributed to reducing that IJB's annual overspend, which seems to me to be an imprudent way of bringing down a deficit that the IJB did not itself create, since it was there when it started. And that is exactly the approach that we are trying between COSLA and ourselves to get the three parties, the IJB, Fife, and Fife Council and the Health Board, to agree that over a 3-year period, for example, they take a systematic approach to reducing that deficit, which would not cost the Health Board or the Council any more money than they have already put out annually, but would allow the IJB to operate on a sounder financial footing. And in terms of the increased demand, of course, that is why in my health budget that was approved by this Parliament, we provided an additional £160 million, an additional £160 million through local authorities for the purpose of integrating health and social care, in order to recognise the additional demands being placed on them from that rising demographic challenge.
Supplement.